Hello and welcome to Leading with the Latest. Fact Forward, formerly the South Carolina Campaign to Prevent Teen Pregnancy, is excited to continue providing teen birth and STI updates to inform your work and outreach efforts. My name is Kimberley Wicker. I'm the Partner Engagement Coordinator for Fact Forward, and I'll be your webinar presenter today. I'm excited to share more about South Carolina's updated data. I've been with the agency for 10 years, and I have a background in social work, communications, event management, and outreach. Before I begin, our agency realizes that circumstances surrounding our work and lives in general are very different right now due to COVID-19. We appreciate the patience, flexibility, and dedication of our partners, supporters, and team members as we all walk this difficult path together. We hope the information presented today will provide helpful resources that you can use and share along the way. I want to specifically thank our research and evaluation team members, Jennifer Pozick and Mallory McGargle, for their expertise and for providing updated content for this webinar. For those who are not familiar with our work, I am going to briefly share more information about our mission and priorities before we dive into the data and other resources. As you can see, our mission is to improve the health and economic well-being of individuals, communities, the state of South Carolina, and beyond by preventing teen pregnancy and advancing adolescent reproductive health. We train and educate individuals who work with adolescents so that they can provide effective programs and outreach. We do this by making sure we're reaching parents, clinicians, and other providers, educators, and the communities at large. Our work focuses on helping professionals and other trusted adults prevent teen pregnancy, prevent HIV, STIs, promote access to services and prevention activities like the HPV vaccine, and provide resources to have effective conversations about sex and other difficult topics with adolescents. These key priorities ensure that we are advancing reproductive health for adolescents. Here you can see the objectives for today's webinar. We will discuss the 2018 teen birth data, which is the most recent data for South Carolina. We will explain teen birth data charts, discuss STI rates and risk behavior, and discuss where to find county level data among other resources on our website. For a little background, birth certificate data is collected by and released annually from the Department of Health and Environmental Control, DHEC. Data is available through DHEC's South Carolina Community Assessment website. Fact Forward uses this data to develop a series of publications about teen births in South Carolina during the year. All of the data on teen births in 2018 that we will discuss today come from DHEC unless otherwise noted. First, let's talk about why teen birth data is important. We will, of course, share more about how we can use the data to connect in our communities later in the webinar, but we want to start by looking at funding, stakeholder information, and how we can show links to other issues. Most of us know that funders expect accountability and want their funds to go to what works. Linking improvements in teen birth rate to continued investment in teen pregnancy prevention shows that funding can help to continue meeting young people where they are. We also know that the data can show where need is in your community, which is often a requirement of grant applications. It's also important to inform stakeholders. Data is also useful to use in discussing the issue with stakeholders like community members, government officials, and even within your own agency. We also know that it's important to show the connection between teen pregnancy, STI and HIV prevention efforts, and other social issues, such as poverty, which helps your organization show funders how they can work together across sectors to impact young people's health and well-being. Today, we'll be talking about the teen birth rate as well as the number of births to teens. This could be a review for some, but it's always important to establish the foundation from which we want to talk about this data so that we all are on the same page. The number of births is the sum of all births to females in that age group. The total number of births in a population does not indicate how the births affect the population proportionately. The teen birth rate is calculated using the total number of births among the age group and the total population of the age group. Teen birth rate is calculated by dividing the total number of births, ages 15 to 19-year-olds in our case, by the total number of 15 to 19-year-old females or the population. This proportion is then taken and converted into a rate per 1,000. Essentially, a key difference is that the number of births is useful when talking about a specific population, but the birth rate is useful when comparing teen births in different populations. That being said, just because a county has a higher number of births, it will not necessarily have a higher birth rate when compared to other counties. An example of South Carolina counties ranked by the number of births to teens versus by the teen birth rate, ages 15 to 19, is here. And in the left column, the rank by number, the list shows only the counties with the largest populations. And with the rank by rate in the right column, it includes many smaller counties that show continued disparities in teen birth rates. When you create a rate which relates to the number of teen births to the population, counties can be fairly compared on the impact that teen pregnancy and birth has on their community. While it's logical that larger populations would have a higher number of teen births, it doesn't make sense to compare populations of different sizes based purely on numbers. It's like comparing the number of traffic lights in Greenville to the number of traffic lights in Allendale. If Allendale had the same number of traffic lights as Greenville, there would be one every few feet, and it would seem like a much more significant issue to that community. And again, we're talking about a very large community in Greenville versus a smaller community in Allendale. Both the number of teen births and the rate of teen births provide valuable information and are useful, but because the teen birth rate provides more context, it is a better choice when comparing different groups. It gives a better picture of some of the disparities in teen births and pregnancies. Now that we've looked at how we want to look at the data along the way, we're going to dive into the 2018 teen birth data. In 2018, there were 3,480 births in South Carolina. With over 3,480 births in 2018, this averages to 10 teen births per day. A teen in South Carolina gives birth approximately every 151 minutes. Again, that's 10 teen births per day, and a teen in South Carolina gives birth approximately every 151 minutes. When examining the number of births from 2010 to 2018 in general, South Carolina teen births have decreased, with the exception of a slight increase from 2017 to 2018. There was an increase of 74 births, accounting for a 2% increase in the number of births from 2017 to 2018. Since the peak in 1991, South Carolina's birth rate has decreased by 70%. However, there was a 1% increase from 2017 to 2018. And again, that's a 1% increase in the rate from 2017 to 2018. But looking at the overall trends, there continues to be progress at that level, but we always want to be making sure that we're thinking through the potential gaps from year to year. Since 2010, the teen birth rate has decreased by 48%. So again, this is another data point looking at a trend over time. Although South Carolina's teen birth rate has decreased by 70%, it has consistently remained higher than the national teen birth rate. The state's teen birth rate is shown by the blue line, and the national teen birth rate is shown by the green line. South Carolina's teen birth rate has remained higher than the national rate. As you can see in the graph, South Carolina's teen birth rate is continuing to decrease. However, as we mentioned before, there was a slight increase from 2017 to 2018. The teen birth rate has decreased by 59% in the last decade. We also want to note that teen birth rates are the lowest that they've been since recording started in 1980. However, South Carolina is the 11th highest in the nation for the teen birth rate. So again, we're looking at the balance between the overall positive trends over time versus areas where we want to pay close attention to from year to year. Now that we've looked at the number and rates of teen births in South Carolina, let's examine demographic information regarding teen births for 2018. And as we get ready to talk about demographics regarding teen births, it's always important to know that these data points are guides as we're thinking about how to best address the issue across communities. They're not necessarily the circumstances of every person in that group, but it is important to look at those overall data points so that we can be thinking about how to be inclusive and thoughtful in our efforts to address the issue for adolescents. Disparities remain in teen births across South Carolina. Black teens ages 15 to 19 experienced a 7% increase from 2017 to 2018. White teens ages 15 to 19 experienced a 6% decrease from 2017 to 2018. Hispanic teens ages 15 to 19 experienced a 3% increase from 2017 to 2018. As you can see, teen birth rates remain high among Black, non-Hispanic, and Hispanic teens in comparison to white teens in South Carolina. Hispanic teens had the highest teen birth rate in 2018, followed by Black, non-Hispanic, and white non-Hispanic. So again, this is looking at the rate from 2002 to 2018 by race. Let's continue to talk about how teen births affect certain groups differently. This chart will show you the population versus births. And as I will go through what is happening in the chart, and then you'll see all of the bars come up as I click to the next slide. Using DHEC's website, we're able to separate the data into 3 racial and ethnic categories: white non-Hispanic, Black non-Hispanic, and Hispanic. The graph shows the percent of population a certain racial or ethnic group makes up compared to the percentage of births the racial or ethnic group accounts for. So the dark blue that you will see is the percent of the population. More than half, or 58%, of the 15 to 19-year-old females are white, non-Hispanic in South Carolina. In 2018, ages 15 to 19-year-olds, out of over 3,400 births, white non-Hispanic were 45%, Black non-Hispanic made up 41%, Hispanic all races made up 13%. Looking at population, out of the 158,474 females in South Carolina, white non-Hispanic made up 58%, Black non-Hispanic made up 32%, Hispanic all races were 7%. It's also important to note that the sum in the graph may not total 100% due to a small number of teens who identified as other race. So again, we're looking at the blue line is the population, and the green line is the percent of births. So each group and their percent of the population versus their percent of the birth rate. And again, this is a guide, a snapshot of looking at these groups so that we can be thinking even more clearly about how to address any disparities that might exist or that do exist. Now let's look at the 2018 teen birth data by age. In 2018, 76% of births were among older teens, meaning 18 to 19-year-olds. 24% were to teens ages 15 to 17. This graph illustrates teen births by age from 2008 to 2018. The dark blue line shows trends for teens ages 15 to 17, while the green line shows trends for older teens ages 18 to 19. In general, birth rates among 15 to 17 and 18 to 19-year-olds have decreased since 2008. From 2017 to 2018, 15 to 17-year-olds experienced a 2% decrease in birth rate, while 18 to 19-year-olds experienced a 3% increase. We also want to note that 18 to 19-year-olds account for about 76% of births to teens. Now that we've looked at some demographic information, we want to look at some overall information regarding sexually transmitted infections and risk behavior among teens ages 15 to 19 in South Carolina. This information is going to be coming, the majority of it, from the Youth Risk Behavior Survey from the South Carolina Department of Education, 2017. It is important to discuss STIs among teens, as the CDC estimates that adolescents ages 15 to 24 account for half of all of the new STI infections. Teen chlamydia and gonorrhea rates have been increasing in recent years. Chlamydia rates are higher in teens ages 15 to 19 than gonorrhea rates. From 2017 to 2018, there has been an 11% increase in both chlamydia and gonorrhea rates among teens. Since 2012, chlamydia rates among teens have increased 15% among teens, while gonorrhea has increased by 44%. When examining this graph, it depicts South Carolina's teen STI rates and the number of teen births from 2012 to 2018. The blue bars represent teen chlamydia rates, while the green bars represent teen gonorrhea rates. The number of teen births are represented by the gray line. When you look at the teen chlamydia rates over time, it has consistently increased from 2013 to 2018, while gonorrhea rates have consistently increased from 2015. As you can see from the graph, chlamydia and gonorrhea rates continue to increase as the number of teen births decline. This goes to show that while births are decreasing, there is still much work to be done in effort to decrease teen STI rates. Here we're looking at HPV vaccination coverage. And in the left graph, the percentage of teens ages 13 to 17 receiving at least one dose of the HPV vaccine in South Carolina is less than the U.S. overall percentage. However, there has been a 35% increase in the percentage of teens receiving at least one dose of HPV vaccine in South Carolina from 2016 to 2017. In the right graph, the percentage of teens 13 to 17 who are up to date on all recommended doses of HPV vaccine in South Carolina is less than U.S. overall percentage. But South Carolina, again, has increased in the percentage of teens who are up to date in all recommended doses of HPV vaccine by 47% from 2016 to 2017. To note, 2017 is the most up-to-date data for HPV vaccine. And if you have questions about the direct references for the HPV vaccination coverage, we will be giving you an email to reach out with specific questions at the end of the webinar. In the graph on the left, as we look at the Youth Risk Behavior Survey, the percentage of high school students in South Carolina is represented by the green line, whereas the national average is represented by the blue line. Since 2011, South Carolina and the nation has experienced a decrease in the percentage of high school students who reported ever having sex. According to the 2017 Youth Risk Behavior Survey, 39.1% of high school students reported ever having sex, which is slightly lower than the national average of 39.5. Again, this comes from the Department of Education, YRBS 2017. Again, in this graph, the percentage of high school students in South Carolina is represented by the green line, and the national average is represented by the blue line. Since 2011, both the nation and South Carolina have seen an increase in the percentage of high school students who reported not using a condom at last sex. Despite having a lower percentage of students reporting ever having sex, South Carolina reported a higher percentage of students who did not use a condom at last sex than the national average. In South Carolina, nearly half of those students who reported ever having sex did not use a condom at last time of intercourse. As mentioned previously, the percentage of high school students in South Carolina is represented by the green line in this chart, in this graph, whereas the national average is represented by the blue line. Since 2011, the nation has seen an increase in the percentage of high school students who reported not using any method to prevent teen pregnancy, while South Carolina overall has experienced a decrease from 2011. In 2017, 15.1% of sexually active high school students in South Carolina reported not using any method to prevent teen pregnancy, which is higher than the national average of 13.8. Later this year, we should hear from the 2019 YRBS data, and hopefully we'll be able to provide an update. But again, this information is from the 2017 data, and I'm sure that they are compiling the results of the 2019 survey from late last year. Now we want you to know how to access information about statistics in your community. We're going to show you how to look county by county. This is where you would find information about our county level statistics, factforward.org/statistics. And a little brief overview about the county facts. Since peaking in 1991, all South Carolina counties have seen substantial decreases in the teen birth rate. 24 counties saw an increase in the teen birth rate from 2017 to 2018. 22 counties saw a decrease in the teen birth rate from 2017 to 2018. The top 5 counties with the highest rate of teen births is Chester, Marlboro, Lawrence, Marion, and Dillon. High volume counties for teen births: Aiken, Anderson, Beaufort, Florence, Horry, Lawrence, which is new to the high volume in 2018, Spartanburg, and Sumter. High volume counties have both high numbers of births and a high rate compared to the state average. Rural counties in South Carolina have a higher average teen birth rate than urban counties in South Carolina, 30.6 overall versus 20.6 respectively. Using the map from the previous slide, you can download county profiles to get even more insight about relevant data points in your communities. As with all data, it is a snapshot and should be used as a guide to inform engaging, age-appropriate, non-judgmental outreach efforts. And as we alluded to earlier, this is another way that you can show how the data is connected to other issues in your community. So definitely use this resource on our website. These are profiles of the 46, so every county has an updated profile based on all of these data points that we've been talking about, as well as partners who have provided information to help us reach adolescents as well. We looked at a lot of information so far, and I know you want to be able to effectively use this information to engage your networks and provide relevant support to your communities. In this section, we will highlight ways to use the data, online resources, and how to contact us for more information. Using the data where it counts. As I mentioned before, we talked a little bit about funding and informing stakeholders and connecting the data points around teen pregnancy to other social issues. Here, we want to talk a little bit more about how you can use it in your communities and personally to make sure that you are advocating for what's best for adolescents. Again, having up-to-date, accurate information will help you to make sure that you're engaging youth effectively, making sure that you're giving, again, age-appropriate information that's based on the needs in your community, that you are reaching young people where they are and giving them information that is helpful for them and that they feel like they are a part of the solution. Also, as we talked about grant writing again, and then other fundraising efforts, there are probably other events that you'll be doing in your community, and your donors, your participants are going to want to know how what they're funding, how what they're donating to is impacted, and they're going to want to know those data points and see how things have been changing over time. So that's why, again, it's so important that we're looking at trends over time, but that we also are looking at year-to-year information, that we're looking at resources on the ground so that we can adjust appropriately to make sure that we're taking care of our adolescents. Also, it's important that we can tell stories and reach out to the media and get more awareness about the issue and about how to help our young people. Of course, I think many of us know how important it is to have those data points when we're trying to tell stories. So it's that head and the heart, making sure that people, definitely are impacted and they are engaged and they feel the connection to the issue, but that they also have those facts to be able to move forward and do what's the most effective for their communities. And then, of course, just general community awareness, including those events and the media stuff, but also, do you want to be updating publications? Do you want to be hosting roundtables, poster sessions, anything that's going to reach your community and increase awareness along the way? And then we also have awareness campaigns, particularly in October and May when it comes to adolescent reproductive health. October is always Let's Talk Month, which is a national campaign from Advocates for Youth. And we always in South Carolina try to participate in that by providing funding for events, data updates for you, as well as speaking opportunities as well. And it's a great way to to reach parents and to make sure that trusted adults and parents have resources to meet the needs of the young people in their lives. And we always update our website with great resources during October. And we are in May 2020. So we actually are getting ready to start Reproductive Health Awareness Month. And it used to be Teen Pregnancy Prevention Month, and now it's Reproductive Health Awareness Month in South Carolina. And we will be making sure that in addition to resources like this webinar, you're able to go to our website, follow us on social media, wherever we are, to get those data points that you need to reach your communities. And then we have staff members that want to make sure that their colleagues have this information. It's always great when you're doing that outreach and when you're planning those programs that your whole team is on the same page and your whole team knows why. Why are we doing this work? Why are we developing these programs in this way? Why are we targeting these communities in this way? And the data points, having that update at least every so often, once a year, whatever, your timeline is, we'll make sure that everybody is invested and that they have the right data to help them get the word out. And then when you're in a field like this and you're talking to family and friends, they do want to know more about how they can help, how they can get involved, how they can help their own kids in their lives. So share this with family and friends on a personal level as well. Especially during our current situation, it's important to know where to find our resources online. That's another reason why we wanted to review the data, talk about the resources, and then show you how to find it online. Again, a lot of our working circumstances have changed due to COVID-19, but also it's convenient to be, regardless of the circumstances, to have this information on our website. So our website can help along the way to be able to get that information. Also, I briefly mentioned that we were formerly the South Carolina Campaign to Prevent Teen Pregnancy. So with that name change also comes a little bit of a change in our look on our website. So where to find information on our new website is important as well. No matter your role in an organization, a community, and or your family, you can help young people connect to age-appropriate, medically accurate information. So using the resources section, you can learn more about how to reach adolescents where they are, your community, your church, your health center, your school, you name it. So here you can be an ally for young people, and no matter what your role is, all these different dynamics are in play. So we have this resources page here to help you engage along the way. Also on our new website, information for research for reaching adolescents is found under the resources section as well. For those of you who are familiar with us as our former agency name, you know that we did have a website for teens and young parents, and now all of that information is in one place, and it is under our factforward.org website, and it's under the resources page. So here is the direct link to get to information directly for teens. To get access to our fact sheets, you want to visit the Fact Forward homepage, click on the menu, and you can find under that same resources section our work brochures and fact sheets. Again, especially with circumstances now that we're not physically engaging as much, you want to be able to download this information at your convenience. So we wanted to make sure you knew exactly how to get that information. And again, those brochures and fact sheets talk about how to get involved. They talk about those data points that we've been sharing, and they provide a great resource for you to be able to go back to. Because of course, we've talked about a lot of different things today. I provided a lot of data points. So it's always good to know how you can come back and follow up to review and to be able to share that information in a way that's safe and convenient. Again, we realize that we are experiencing these unique circumstances as it relates to events. So we're going to continue offering virtual opportunities when possible. We look forward to engaging in more in-person trainings and events when the time is right. In the meantime, know that we will update our offerings on our website. So again, this is our events page, factforward.org/events. And there will be a lot of webinars, a lot of virtual opportunities, but we definitely, when things are safe for us to be doing more in-person trainings, outreach activities, awareness events, we will be listing all of that here in the events section of our website. Also, use our website to learn more about upcoming conferences, summits, curricular options, and initiatives like Crew for Healthcare Providers. So here, we'll talk more about the conferences, because again, that does speak to the events and the changes and how we're going to have to do stuff for the near future. But definitely, if you have questions about curricular options and initiatives that you can engage virtually, we do have a lot of great resources underneath our education and training page. I alluded to Crew. CREW is an initiative that specifically healthcare providers can find some very direct information networking opportunities. And we'll definitely, again, provide a website, email address at the end of the webinar that you can use to get more information. But this is a collaborative where healthcare providers can collaborate, find practical data-driven solutions, and help improve clinical outcomes for adolescents. So we've, definitely heard that participants in the past and current love the ability to be able to network and to get insight from peers and to be able to share and grow along the way. So again, if you're a healthcare provider, we thank you all that are essential workers for all that you're doing. We know that there's a lot of priorities out there right now to keep everybody safe, but do know that when you need that professional development, when you need those opportunities to engage when it comes to reaching adolescents, we do have this opportunity for you that has been really engaging for people in the past. And then we talked a little bit about events, but we do have these two conferences that even with the circumstances, we want to make sure that you know about. Summer Institute is our signature statewide conference for all youth serving professionals that we've been doing for more than 20 years. And although we've had to postpone, if you haven't heard, we were supposed to have it the first week in June of this year, but we are going to wait out of an abundance of caution. We've got to make sure that we're thinking about our health and our safety first. And so we're going to wait until June 15th through the 17th, 2021. Again, that's June 15th through the 17th, 2021. And we will still be in North Charleston, South Carolina for that. So you can still go to our website and click on more information about how to prepare for that next year. And then our Contraceptive Leadership Summit is a place where a lot of those members from CREW that we just talked about can come and share with even a broader audience. And then we can get other people involved in having very specific conversations about access to teen-friendly reproductive health services. And that's usually in the fall. And so we'll definitely be continuing to monitor the situation and keeping everyone informed on next steps for scheduling the Contraceptive Leadership Summit. And finally, thank you for walking through this webinar with me and reviewing a lot of data points, but also looking at a lot of ways that we can engage, we can use this data in our communities, and that we can work together to continue advancing adolescent reproductive health. So in closing, you can find us on social media, find us at our Facebook page, follow us on Twitter, Instagram, and then I have been talking about contacting us for more information. If you have any questions about the data points that I talked about today, if you have any questions about how to get involved or how to participate in specific activities that I have mentioned today, please reach out to training@factforward.org. Again, that's training@factforward.org is where you can get more information about the data, about ways to get involved, and about participating in activities that are coming. So thank you all for watching the webinar. Thank you all again for all that you do to help adolescents in our state and beyond. Take care.